President Trump holding a meeting in the White House on health care. He's actually meeting victims of Obamacare. Alex Azar joins us now, former Deputy Secretary and former Lilly USA President. All right, Alex, they're trying to get the two sides together to agree on a plan to reform and repeal and replace Obamacare. I got it. I've got this question. If a poor person gets sick, like cancer or something serious, a serious accident, who pays?
Well, we all do. We all did before Obamacare.
Yep.
We are now under Obamacare, and we will under the House plan. The way we pay is we fund community health centers where the poor can receive care. We fund nonprofit hospital systems who, as part of their mission, are supposed to deliver care to the indigent, and then we give subsidies called disproportionate share hospital payments to hospitals to reimburse them for that. And we pay by subsidizing Medicaid to get poor insurance packages. So we all do pay. Care is available. It's just how it ends up getting paid for and reimbursed.
Now, there's a conservative plan, the Freedom Caucus. They want to get rid of Obamacare totally and completely. There is the Ryan plan. Would either of those two plans change the nature of who pays when poor people get sick? I take it that neither plan would change things.
Well, no, it would change the nature of who pays and how it's paid for. So the Ryan plan that's moving through the House right now, what it does is scale back this very huge Medicaid expansion that occurred during Obamacare. And it says we had funded that Medicaid expansion in part by pulling back these hospital subsidies, those things I said that are called DSH payments, disproportionate share hospital payments, for who disproportionately take care of the poor. We pulled those down to increase Medicaid. The Ryan plan scales back that Medicaid expansion, but restores DSH payments to hospitals over this period. So the states that didn't do Medicaid, they're going to all of a sudden get those DSH payments, and then the other states in 2020 start getting their DSH payments back. They also fund $422 million of additional funding for community health centers that provide health care to the poor.
Do you know anything about the Freedom Caucus plan?
Well, the Freedom Caucus plan would be simply to repeal Obamacare. Now, that just restores it to before Obamacare. You'd get rid of the Medicaid expansion entirely, and you would have those DSH payments completely come back then immediately, or as of whatever the date of the transition is of that moment.
See, what I want to wrap it up with is this. Whatever new plan is put in place, poor people who suffer a catastrophic illness will not be left out in the cold. Can we say that?
That's one of the beauties, and has been for the longest time, of our system, that we really do take care of those who can't afford to have insurance. They still have access to care. Now, listen, it's still better for people to have insurance, and that's why the House plan is working to actually create more affordable entry-level vehicles of insurance for the poor as well as everybody else in the individual market. That's the beauty, is longer term we ought to get these people into insurance, whether in Medicaid or the individual market, with lower cost alternatives, as Obamacare now circles the drain and goes down.
Now, the money that goes to poor people, if they've got insurance, or they've gone through the exchanges or something like that, the money that goes to them, that will in future go in the form of a tax credit. This is the Ryan plan, a tax credit as opposed to a straightforward government subsidy. Would the tax credit be up to the job of taking care of them health-wise?
So what you're going to need to have is that tax credit, when it gets out there, is going to create a marketplace for individual insurance. Because trust me, with tens and tens of millions of Americans having a tax credit, basically a voucher of money to buy insurance, the insurance industry is going to see that as an opportunity and come up with flexible, affordable vehicles of insurance for those individuals, especially because the House plan gets rid of so many of the restrictions on individual insurance that have made it so unaffordable for young, healthy people and people who are not employees of big companies and don't get their health care through big employers.
Okay, so everything will be taken care of. But see, what I'm thinking of is, when we get this plan through, the left is going to say, I know what's going to happen. This afternoon, the CBO is going to score this thing, and they're going to say 6 to 15 million people will be left out in the cold. They won't have coverage. Coverage will be taken away from them. Is that accurate? I don't think it is.
It just can't be accurate. Those numbers don't make any sense because, first, it assumes that Obamacare stays the way it is, and it's going down the drain. The number of insured are going down as that market is collapsing. So, first, the status quo is not what they're saying it is. And secondly, you're going to be reforming the individual market. You're going to make, right now they're making young people subsidize older people through artificially high premiums. They're going to fix that so that people pay more of what their age cohort is costing the system. They're going to be pulling the sickest people out into high-risk pools, and then they're going to be creating these vehicles through HSAs and through these tax credits that create a slew of money out there available for people to get into this newly more affordable market.
I've got to cut you off because I'm about to leave, but you've satisfied the question. Nobody's left out in the cold. Thank you very much. Alex, we appreciate this because it's very complicated stuff. Thank you, sir. Appreciate it.
Thank you, Stuart.
Okay.